if you are running a campaign and you generate a lead that comes into the office and they don't know you, like, or trust you yet, or maybe the next step in your workflow is a telemedicine conference or a Zoom call or something like that. They don't know, like, or trust you. What's going to help build that trust is when they know that you're not just trying to sell them something. When you take a personal interest in how their sleep is, how their relationships are affected by their poor sleep quality, or their inability to use a CPAP because of the frustrations they experience. When you take an interest in those frustrations and you ask, how's that been affecting, like, I know you said you were married, has that had any effect on your marriage? When you take a personal interest, that builds that trust, and that person is going to be more compelled to move forward with the next step, whatever that is, in your sleep workflow. So try that. If you are running any type of campaign where you are direct marketing to the public rather than a physician referral, or maybe you're trying to accelerate the growth of your practice by marketing to the public, try connecting with people on a personal level, and you're going to notice that you're going to build that trust quicker, and those patient leads are going to very quickly become your patients because they actually know how much you care. And I believe it was Zig Ziglar, but don't quote me on the source, but I believe it was Zig Ziglar who said, nobody cares how much you know until they know how much you care. And that could not be more true when it comes to reaching out to patients who do not yet know, like, or trust you. So